Nigeria is said to have climbed the plateau of coronavirus pandemic, with the daily upsurge in confirmed cases and deaths reported to be more than 900. The Minister of Health, Osagie Hanare, had on April 2 warned that the country had started showing early signs of community transmission of the COVID-19 contagion. This singular mode has continuously propelled the figures above the 40,000 threshold. This stage of the pandemic is the most dreaded because of the potential bigger humanitarian crisis that may result if the rate of the spread is not curtailed. Even before government began the gradual easing of the lockdown, Nigerians had gone back to their old lifestyle of socialization. Increased movement of people is being recorded and banking premises are crowded with customers. Cash transactions have spiked, and exchange of dirty currency notes, which can contribute to the person-to-person transmission, is a constant feature. Shops, local and open markets for essential and non-essential purchases within several communities are fully operational. The tradition of price trial and test fitting of goods is back in full force. Some people till date even doubt the existence of the virus, saying the statistics are just being played up for selfish reasons and to cow residents.
We do not see anything like coronavirus. Coronavirus is in abroad, not here.
They are lying because I've never seen someone that have the coronavirus in this Nigeria.
It's not real. They are using it to defraud the masses that we are already suffering. If corona is in Africa, in this vicinity, about 30 people are supposed to die to make me convinced.
In tackling the spread of the virus in various localities, the Presidential Task Force Chairman, Boss Mustafa, stated then that the next thing to do is to introduce a community-based approach in contact tracing to reduce rate of infection.
We have developed a national response which has been cascaded to the state, but the communities must plug into the national response. Where we have primary health centers all over the country, they can be used, you see, as stations of reporting, of surveillance within a particular community, of tracing, of tracking, so that we can take out those that we suspect have exhibited symptoms or have come in contact with people who have exhibited symptoms for testing and isolation.
In light of these, the role of community leaders in convincing and educating members of their locality on the existence and debilitating effects of the virus becomes imperative.
If Lagos State Governor have decided to bring in the CDC and the CDA to educate them over this community spread, so we also want to keep in line with the community spread, that this thing is getting out of hand. We leaders have to rise, both in our marketplace, both in any way we find ourselves, to do the needful for the betterment of all to survive.
There is need for advocacy and re-advocacy on the part of our people, and that the advocacy too should be localized. Our imams at Eid, our cleric, the ballets, the obas, the market leaders should be adequately involved in this message, so that it can sink to the ordinary man on the street that COVID-19 is real.
We are reaching out to all the various markets in Lagos State to make sure they all have this nose mask to prevent coronavirus, COVID-19, to make sure it does not spread.
This coronavirus is real and is here. You see, and we have to teach them on isolation, physical distancing, and we're teaching them also on contact tracing. We have our feedback system, and all of them will be getting back to us. We monitor what they are doing through our coordinators in all these various local governments.
Since the World Health Organization declared the novel coronavirus outbreak a pandemic on March 11, the world has struggled to keep it at bay. However, the key to accelerating the fight is to have leaders engage people in the right way, at the right time, with the right information. Lekan, Onabanjo, LTV News.